friends, and thank you for tuning in to another episode of the Optimal Health Program. Today, we're going to talk about compounding pharmacies and how important they are and have become over the past few decades. When doctors typically write prescriptions, and this is ongoing for obviously many, many, many years, today they write a prescription and that's sent to a pharmacy, and medications that are given to you are not made there. They're made in a gigantic facility and then shipped to a regular pharmacy. But back in the day, and certainly before traditional pharmaceutical manufacture had come along, pharmacies were apothecaries and compounding pharmacies, and they would make a prescription specific to the doctor's recommendation. A certain amount of this, a certain amount of that, put it into a gelatin capsule, make it into a liquid, etc. And you can see some of this in some of the movies that depict, things occurring in the 1800s and such. And old Wild West movies, you'd walk into an apothecary and the doctor would have recommendations and all these things on the shelves. And I actually have some of the things from apothecaries back in the day. I went to an antique fair in Brimfield, Massachusetts years ago, was able to buy some of these bottles and crazy devices they used just because it fascinated me. But at any rate, compounding pharmacies were always here, and the mega companies came along and changed that a little bit. But there's a great resurgence in the past few decades because people need to have either more pure combinations or remove fillers, binders, excipients. And with what the compounding pharmacists can do today, it's amazing to see, and certainly we're going to talk about all of this. So today we have Isha, our favorite compounding pharmacist here from Hatch Pharmacy, and she's going to chat with us and explain all of it. Good morning. How are you?
Good morning. Thank you, Dr. Calapai, for having me.
You're welcome.
Here.
A pleasure to have you on the show. I love it when you come to the office, so it's great to have you chat for the listeners and the people that are viewing the podcast to get a good explanation ongoing.
Rightly said. It was like age-old practice. People used to make it in-house in 1900s. It changed everything, but that still survives for the 90% of the patient population that we have, the 10% of the people who need everything preservative-free, dye-free, and that's what we are here for. We're here for that tailored approach.
It's the way it should be. It should be the preferred availability, because why should people have fillers, dyes, binders, excipients, and such in pills that they take every day? And the same thing occurs with foods. Now there's this massive discussion about getting rid of all these chemicals and dyes in foods because in other countries they don't allow these things. So, yeah, this is extremely important.
Sure.
What do you see in terms of trending? I know that there are many things that are being used today that are compounded prescriptions compared to just, I'm sure, many years ago there were just a few. I know that you do thyroids and hormones, male and female hormones as well, and creams and gels. It's wonderful to see how these things can be made so pure.
So in terms of trending, obviously hormones are on top tier right now. People have realized that it's so important to replenish what their body cannot produce in the optimal amounts anymore. So we are here. We work with micronized, non-synthetic hormones that we compound for our patients. That's number one. Then we see a lot of dermatology products for skin, for anti-aging, for acne, for rosacea, for melasma. And a lot of our patients with hair solutions. That's like, I would say, our top three. Not forgetting about all the functional stuff that we do with low-dose naltrexone, methylene blue, ivermectin, you name it. And we are working probably with some patients somewhere trying to figure it out for them.
So let's talk about the hormones for a moment, because people have this preconceived idea that hormones may be bad because that's what we've been told based upon what I would describe as slightly inaccurate comments and research. So there have been hormones made from conjugated equine or horse extract, Premarin, pregnant mare's urine, and there may be some risk with that, again, based upon research. Using a natural product, typically from, wild yam extract, is a much safer way to go, and it's so much easier on your system. You mentioned micronized. Can you explain what micronized means?
So yes, all these hormones, what the term that we're using is called bioidentical.
Mm-hmm.
What that means is it matches the exact same chemical structural ring of your body's natural hormones. So it does not give you side effects, and it's easier for your body to transition. It does not treat it as a foreign substance. We use bioidentical hormones derived from either yam or soy. Not that much soy because we have a big patient population that might have that as an allergen.
Okay, important. Good to know.
Yeah, so we focus mainly in our pharmacy. We have everything from yam extracted, progesterone, estrogen, and testosterone. And when I say micronized, these particles are less than 10 micron in size. So when we apply them topical in form of cream, we rub it on, they absorb really, really well through the dermal layers. So micronized just means that they are super fine and they absorb well. They give you that balanced levels and balanced hormones, and definitely derived from yam to give you that more cleaner approach to it. Obviously, equine hormones are not structurally similar to human hormones. So that's why people have more side effects with that. And yam gives you that edge over it to have being identical rings.
It's a world of difference. It's so important to discuss this and for people to understand that these better sourced products are available. And you talk about estrogen, progesterone, of course. We use both, for women. And in many cases, we use progesterone for men because it really helps them to sleep at night. It also can decrease anxiety and such. DHEA, another very important adrenal hormone, which I know that you do a great deal of. Testosterone. And here's an important comment on testosterone. So overwhelmingly, men need to have their testosterone levels come up when their levels drop. And some men will drop in their 40s, some a little bit earlier, most of them their 40s, 50s, and 60s, and they lose that edge. They lose that ability to have great memory, focus, concentration, mood. Of course, they get anxious, irritable. They're gaining weight because the testosterone's not there to help them burn the fat. So giving them, and we do testosterone shots, which is a good way to start because people need to get their levels up. And over the course of a couple of weeks, if you give them shots, their levels come up quicker. They know where they need to be. They feel it. We document that. And then we give the prescriptions so that they can, contact you and get the testosterone creams. So the cream can be placed in a variety of areas, whether it's on the inner arm, on the abdomen. Some people will put it, on the genital area, on the scrotum. That can be a great way to help to restore the daily dose that you need. And in similar fashion, that's coming from the natural extract, correct?
Yes, that's from yam as well.
So very, very important. Dosing and then time of dosing also depends upon each individual patient, but it's important for patients to have that. Years ago, and of course you know this, but a lot of patients were given patches and other things that were just unwieldy and sticky and uncomfortable and just not easy to use. And with the compounding process that you've done, it becomes very easy to take a pump, put a little bit of that cream on, and you're set and you're good. We've seen no side effects with that. We also can recommend the sublingual testosterone little pellet that dissolves under your tongue, and we use that for a bunch of patients. So, yeah, there are some great options.
That's absolutely there is no one size fits all. Every patient is very different. We have seen having 5 patients on the same dosing and everybody responds differently. So that's where the compounding comes in. There's no one size fits all. There's no standardized dosing. One pump works for you, 2 works for somebody else, and maybe some other dosing works for somebody else. So that's why we can go as detailed to the T to what your prescriber wants, what Dr. Calapai wants. We can make it to that exact dosing that works for that exact individual.
Yeah, the beauty of us working together with this, and certainly my blood test eval recommendations and working with you, putting the patient on it, rechecking their blood within a couple of weeks to see that either that dose is correct or they need a little bit more, or maybe they need to do it in the morning, other people need to do it at night. So there's a lot of variables that we want to be able to control to get the best outcome and best result. And that's typically what we do. But, poor Isha, I call her all the time when I have an idea or I want a new product or this or that. We've spoken about methylene blue, the rapamycin, which are spectacular in the world of anti-aging. We'll get to that in just a moment or two. Another thing that we do a great deal of is thyroid, because typically thyroid for most patients is confusing, in part because traditionally doctors will only look at T4 and TSH. TSH is your brain telling you how much thyroid gland to make so that your neck would make it. And then the gland in your neck, obviously, makes T3 and T4. And that'll go to all your tissues, hit receptors, and do the job. As you get older and the gland is not making enough T3 and T4, let's say the T3 keeps dropping, it's not totally low yet, or the T4 keeps dropping, not totally low yet, your TSH may start to creep up a little bit, initially within the normal range, but then it starts to go out of that normal range and will go of and above a measurement of 4 on the blood test. So if the TSH goes above 4, it's asking for hormone. And at some point, if the gland can't make the T3 and T4, they drop. So there are people in various areas or various circumstances with this. So some people might have a low T4 and not have a really high TSH. Doctors may not be looking at the T3, whether it's low or not. They wouldn't know because they're not testing it. And people are given one type of thyroid. The most common is synthroid. The slight drawback to that is synthroid can correlate with osteoporosis and is only giving you T4. And you may not get the T4 converted to T3. So that's a bigger problem. But again, a lot of doctors that are just testing T4 and TSH don't see that. When I see patients, we test T3, T4, TSH, free T3, free T4, reverse T3, all of these things, thyroid antibodies, so we get a complete thyroid picture. So in many cases, when we see patients on Synthroid, their T3 is low, and the doctor may be pushing up the T4 to try to correct the symptoms, but not getting the result because the T3 is still low. So that's why we like using the T3, T4 combination, USP thyroid, compounded thyroid, NP thyroid, etc. And so that's been a great benefit to people who are not getting the right combination of thyroid and really not getting the results they like. So, and there are many different levels, as we say, of correction. So we go back and forth until we see that the dose is creating the best result, through blood testing and patients listing and documenting their symptoms. So the compounded thyroid is the one that you use and make the most of. I'm sure every doctor that's intelligent is requiring that from you.
Right. So we do see a lot of USP thyroid. It's a porcine thyroid. And then we also have these combinations, like you said, T3 and T4. A lot of times patients get on levothyroxine and leothyroxine, but then we make in-house T3 and T4 combinations, microdosings, based on their levels. If they want to just go up on the T4 and leave the T3 where it is, we can do that. Or we can come up with infinite combinations based on what the prescriber wants in terms of T3 and T4. Like you said, T3, balancing that is very, very crucial. And a lot of times that gets ignored in a regular testing. So we do that, and we do USP thyroid for people.
Yeah, so with just a T4, whether it comes in the microgram dose in 25, 50, 75, 100, you don't have a lot of variability there. So that's the way it comes. With other thyroids, even the regular thyroids like Armour thyroid, which is very good, 30, 60, 90, 120, good. But you may need to have a little bit more T3 or a little bit more T4 or a little bit less, etc. So that's why you can correct that based upon what we recommend. And we love doing that because a person doesn't have to fit into the drug milligram dosage that's standard and made that way. So that's why we like to be able to adjust either of those two to create the best results. So there's a lot of science and art involved in fine-tuning these things, and that's what this process, the compounding pharmacies, can create, can do. So let's talk a little bit about the anti-aging realm. I know you have a lot of different creams that are used, and we use many of them. The rapamycin cream, I think, is a genius idea, as well as using the capsule.
The credit goes to Dr. Calapai. He's always keeping us on our toes. He's like, you know what? Let's look and do some research. So we do need, Dr. Calapai. I'm gonna say that you one of the pioneers who keeps us up to date with the new research and new data, and we jump on it with you. So it's great. It's working really well for our patients.
Terrific conversations that I say, Isha, there's this information I want you to take a look at. And of course, research on rapamycin is amazing because it helps to improve longevity. It decreases the senescence or the degeneration of cells, and that's why it's been used topically as a cream. And there are a lot of research studies on this that you can find on any of the great research engines, PubMed, even NIH talks about it having anti-aging benefit. And capsules of rapamycin have been used on studies that involved mice. They gave the mice rapamycin, which is an mTOR inhibitor for those chemists out there, and the mice lived 3 times longer. So it extended their lifespan significantly and dramatically, and done on a variety of other smaller animals, etc. So rapamycin also has been used as an immune beneficial drug for the human population. So we like the idea that you can put something on board that can help and improve this area, this condition. And similarly, we like the methylene blue, and that's been around for forever. And you can give us a little bit of your update or comment on that.
Methylene blue started as a dye, and then it was used in testing. And now the other side, it's a hormetic drug. What that means is it works very, very differently on higher dosing and very different on the other spectrum on the lower dosing. So at the dosing that we are seeing from like 10 milligram to 25 to 50 milligram, it helps with any kind of like neurological benefit. So it helps to with the memory, with prevention of Alzheimer's, with people dealing with Lyme, mold, and to prevent any kind of like infections. So there is some research involving like its benefits with cancer and stuff too.
Great studies on neurodegeneration. The only slightly funny side effect is that when you go to the bathroom and urinate, it comes out, bluish green. And if you're outside somewhere, you may not care too much, but if you're home, you don't want it to sit there too long because it may stain the toilet bowl a little bit. But, we can talk about anything here on the program. So we'll cover all sorts of, interesting ideas and topics. But so I think it's important because it can help mitochondria. Again, we tell people, and we'll give handouts, and I have in the wall of the exam rooms up on the cabinets, articles of methylene blue, rapamycin. We talk about Epstein-Barr virus and correlation with other diseases and problems. So there's a list of different things that we like people to take a snapshot with their phone and then just go look at some of the articles and research. We try to get everybody to look at the research. And Google Scholar is probably the easiest of places to go in and type in the, the header what you want to look for, and you can come up with tons and tons of research in moments. So it's great that I get people to look at the research and such. Tell us about some of the other creams and things that you use for different applications.
So we do make a lot of pain creams. We have a lot of athletes or like elderly people with chronic pain issues, and they have to apply a little bit of this, a little bit of that, and get like 5 creams on board, something for inflammation, something for muscles, something for nerves. And what we do combine them all in one. First, you save them a lot of money. And second, it's ease of use. They just have to apply one cream that takes care of their, it hits the pain from all different angles. And then it also prevents, or it also skips the first pass metabolism. It does not go through, they don't have to swallow it. It doesn't bother their tummy. And it works right on the site of action. So pain creams for us are a really, really popular dosing form where we can but exactly what their physician wants. They want something for neuropathy. They want something for inflammation in there. We can combine all of those. So that's one of the great options for our patients.
Makes great deal of sense. You're creating, you're creating something that answers the question or answers the need for people to have something to work on pain and neurologic issues, where in many cases taking the oral pill may or may not help. Or certainly the oral pills, there are more side effects associated with that. So to put a few of them together in a cream that doesn't have the expense of using the capsules for all of those drugs, is a terrific, terrific idea. So again, I think it's, very forward thinking, very cutting edge to be able to use these things and, create great results without the side effects.
Right.
And I know this is something that excites you as it does me, that there are people that when we put these combinations together get really great results because of the way that these things are, put together. So it's a great way to help the population by using better combinations and things that are more pure.
Dr. Calapai rightly said, we see these patients who have tried everything and anything in the commercial world, and they're like, oh, it's not working. It comes only as like 2% or 4%. And clinically, you can go higher on the percentage to benefit them. And when you see these therapies working for them, it gives you so much pleasure with what we are doing. We are on the right track.
Sure.
We are trying to serve that need that's unmet in like 5 or 10% of our patient population.
It's ultimately specialized,
Yes.
to that specific patient, where you can't fit the patient into something that is unchangeable, but you could actually change and adjust something so it fits the patient, appropriately. Let's also talk about low-dose naltrexone.
Right. So I always get that question from the patients, low-dose naltrexone. Low-dose naltrexone is very, very popular in like European side of the world. It is approved, FDA approved at 50 milligram dosing. But when we say low-dose naltrexone, that naltrexone, we're talking about 1 milligram, 2 milligram, 5 milligram, that kind of dosing. So 1/10 of the dosing that is FDA approved in the United States. Now, at those dosing, it works as an anti-inflammatory. It works on your inflammatory receptors. It works on your toll receptors to prevent any kind of like autoimmune functionality and to produce endorphins. Tons of patients from all different realms, people in the GI world with Crohn's disease, with IBS, in the autoimmune, with fibromyalgia, lupus, people with dermatology, having psoriasis or pain specialty. We have chronic pain patients, CRPS patients. We have fibromyalgia patients. So all these different patients, they benefit from that low-dose naltrexone, which has minimal side effect profile, and they sleep better. They can tolerate that better. I have patients who have gotten off of opioids because they've started using this LDN that has helped prevent the inflammation. And most of our pain in our body is related to the inflammatory response. So they have done tremendously well on LDN.
And in similar fashion, you can start with a low dose and work your way up and watch the patient give you feedback as to how well they're doing. There's great books on low-dose naltrexone. One of the websites, I forget the exact site, but it's a low-dose naltrexone homepage, has a list of 75 to 100 different things that they've got research on that it helps to work with. So there are a lot of applications for it. But I think, it makes a great deal of sense. You want people to be comfortable. You want to inhibit some of these bad inflammatory mechanisms. And once you're hitting it at the base point, you start to see far greater results as opposed to just trying to give, a pain reliever. And unfortunately, and everyone knows about, narcotic medications and the legal issues that a few companies have had because they made medications very, very addicting. And of course, that made these companies very wealthy. And I think some of the legal issues where these companies have had to pay billions of dollars in fines because they did this incorrectly and certainly immorally and illegally, this is something that's happened. So we'd much rather have things that can work well, that are not dangerous, risky, or, that people can get addicted to.
Right. The site that you're mentioning, I think it's called LDN Research Trust. Mm-hmm. It's a European research trust that has wonderful testimonials on it, on how patients have benefited. Personal story, I deal with discoid lupus, mm-hmm. and I was put on Plaquenil. 2 years into this now, starting LDN, that I did not have to take Plaquenil anymore. Wow. So my autoimmune and my inflammatory responses are all under control. LDN has tons of benefits at that low dosing. And like you said, we titrate people from 1 milligram and go slowly and steadily. So if your dose is 3 milligram, that's the dose you have to be at. You don't have mm-hmm. to go beyond that. So what we're trying to do when we're titrating, we're trying to figure out that personalized custom dosing mm-hmm. that benefits you as a patient, so we can keep you at that dosing. Mm-hmm. If it takes for your body a little bit longer to go on that path, we support you by making those custom capsules at that particular dosing for right. you.
Again, specific, detailed, personalized recommendations, so that as we work together with the recommendations and patient follow-up and evaluations and looking at all their symptom changes, one of the things that I do with all patients is give them a symptom checklist. So when I see them right. first in consult, and I made this up, and I'm not, gifted with printing and, art-wise. That's my dad and my sister are great at art and drawing and such. I made a little piece of copy paper, and I made a column on the left, and then across the top made 4 different weeks, week 1, 2, 3, and 4, and wrote symptom checklist on the top. And in the first week, people tell us, are there any changes in all the things you're following? It could be 2 things, it could be 20 things in the left column, your symptoms, your problems, and how much better you're doing week to week. So we really have some great documentation on how well all the things that we recommend from A to Z are working. So together with that, and we give you the feedback, we can say, okay, let's bump the dose up a little bit. Let's bring the dose down a little bit. It's just a great way to be able to walk patients through their problems with some better recommendations and better results.
Absolutely. It's customization to the peak. We're treating one patient at a time.
Are there any other new things you see coming out on the horizon?
I have, so what we are seeing right now, a big move with anti-aging creams. We have an estrogen-based cream for our postmenopausal women. Mm-hmm. We make this in with hyaluronic acid, vitamin C in a biopeptide base. Mm. Estrogen that we use in there is estriol. It's not very potent, but it works very, very locally on the receptors on the surface to prevent any kind of fine lines and wrinkles. Mm-hmm. The hyaluronic in there is good for hydration. Vitamin C helps with brightening. And then we put this in a very nice base called biopeptide base that helps to produce collagen. It has 2 different peptides in it. It's giving great results. So that's I'm very excited for that product to see what it does for our patients. Working really, really well so far.
So I have a question. Asking for a friend, of course. Can men use that too?
Yes, men can use that at a very, very low percentage. We're going to have to drop down the percentage of estrogen on that, though.
Okay. Sounds good.
We can add a little bit of tretinoin if you want.
Yeah, sure. My followers, male and female, are always looking for that next great edge. I have a couple of friends. One that I talked to today, he's a brilliant attorney. He has different offices, very high end, and his brain is great. He's a really good friend of mine. I call him Charlie, because he's 2 people. Sometimes he's just very brilliant. But we had a great conversation talking about peptides and talk about anti-aging. And he'll look on the computer and he'll find something maybe esoteric and may not be, but we always have these great conversations about what's the next thing to do for health, for fitness, endurance, strength, and he's on board. So I have to always chat with him and give him the latest, and certainly talk with you and talk about that. But he's a client of yours as well, because we have him on the rapamycin and a few products. So it's wonderful to think that, understanding the need for patients and thinking forward, stepping out of the traditional box, can work well and get patients very strong and healthy and looking good.
Totally.
So we'd love to have you on. We'll have you on for a few, repeat engagements so you can tell us the new things that you're doing. We'll talk about a variety of different things. But it was great to talk to you and see you over the podcast today. And I'm sure I'll see you in the office at some point this week or next week. And we'll brainstorm.
Pleasure.
This is what we do,
you.
people. We brainstorm. She and I will brainstorm. It's like Frankie and I brainstorm.
We work
His
together
wife
as
Sabrina
a
that runs
triad.
everything, we brainstorm. Yes. Thank you so much for coming on the program today.
Thank you, Dr. Calapai.
Have a wonderful day. Okay, so let's open the phone lines to people that may want to call in to ask a question. Phone number here is 888-420-9272, 888-420-9272, and we'll get your questions out here. I keep saying on the air. We're kind of on the air, right?
Oh, we're on the air.
I'm used to these old terms from being on the radio for so many years, and had a lot of fun with that. And people would call in and ask lots of questions about all sorts of things.
It's funny because during that interview, we got about 5 calls into the studio. People
Awesome.
no one realized that they weren't open yet, those phone lines. But now, now they are.
All right, so people call in, ask your questions. 888-420-9272. We could easily take 5 calls. The cool thing about this is that I'm not limited to an hour. And of course, I suppose if you ask anybody in my family or my friends, I'm a long-winded person. I'm not one to just stop chatting about something that I think is interesting. And of course, when I used to do the radio show and I would announce on the radio that I was giving a lecture at the Marriott Hotel in Uniondale, we would get 200, 300 people to show up and, lots and lots of questions. So it would end up being about 3 hours worth of discussion. At the end of it, my feet were tired, my brain was tired, because it was after typically a long day at work, but it was fun, so I like the engagement, and I like being able to tell people things that they don't know or understand. So a very important part of what I like to do. So 888-420-9272, 888-420-9272. If you'd like to call in to ask a question, you could do so right now. We'll give people a little bit of time to call in to do that. Okay. We have someone that it seems is trying to get through, and they're getting a party you're trying to reach is unavailable.
Uh-oh.
So let's continue to try to get that set. 888-420-9272. So we have a couple of emails that came through yesterday. It's a gentleman who's having difficulty losing weight and has tried a variety of different things. The first comment I make to patients when I see them and talk to them about weight loss is that it's not an individual thing that will create the result. So the way the human body works, it responds to different stimuli, putting things on board, taking things away. So weight loss, just like cholesterol loss, is in the same realm, but we like the idea of using combinations of low-carb diets. You're bringing less sugars on board and doing a lot of exercise to help to improve the ability to burn sugars and fats, as well correcting hormone decline, which is critically important because if your hormones are low, thyroid, DHEA, testosterone, IGF-I, the active component of growth hormone, if they're low, you can work out like a crazy person. You're not going to see the result that you would if your levels were good. And we want to walk your body back to where you were potentially 10 or 15 years ago when you had good hormone levels to create those results. And of course, vitamins are food for your cells, so those are important. So once that comes together, you start to see the changes. So some people need to drop down a little bit more in their carbohydrate. We want to get them at 30 grams per carb per day or below. If they're not there, drop it down. If you're doing a little exercise and you're not doing a half hour to 45 minutes, bring it up. So down on the carbs, kick up the exercise, correct and raise up the hormones, correct and raise up the vitamins, and all of a sudden things start to occur. For some people, we'll use the weekly injectables, because in many cases, people need that little bit of extra oomph to get them over the hump. And if a person's got a lot of weight on board, then that would help to get them out of the danger zone sooner. So yes, that's all, very doable. But it's sort of like fine-tuning a machine or a computer. Lower this, raise that, lower this, raise that to get your benefit, your result. Once again, 1-888-420-9272. We've got a caller. And who do we have on the line?
Oh, just got him on.
Hello.
Hi.
Hi, how are you?
Hi. How are you?
Who am I speaking with?
I have a question. I know my name is Deborah.
Deborah, how are you?
Good. I just have a question about heavy metal toxicity that you've spoken about in the past. I've been told that I've had that, and that came through a hair analysis.
Okay.
So I don't know how you test for it, and how do you do treatment for it?
Okay. Great question. I'm going to have to do a whole show on heavy metals because it's a very significant problem, very significant issue, and I'm glad you asked the question. And it reminds me, Frank, you're going to have to do a whole show on heavy metals.
Sounds good.
So heavy metals are damaging to every part of your body, and there's so much research on this. Heavy metals cause cancer. Heavy metals cause organ decline and failure. The list goes on and on. When you test for heavy metals, there are a couple of ways to really be accurate with it. Hair analysis is not the best way because it's giving you a picture that's already a little bit older than what's happening in your body now. That being said, you can get some information from a hair analysis, although New York State doesn't like that doctors do that. So we typically, with every patient, with your first blood test when you come in, we do a blood test for heavy metals. It looks at 5 metals: aluminum, lead, mercury, nickel, cadmium, arsenic, 6 metals. And it's showing you what's free-floating in your blood. So think about this for a minute. If you have a recent exposure to a heavy metal, and let's say it's cadmium because you use cadmium in your lipstick and makeup, or aluminum in your antiperspirant, that'll get into your system, float in your blood for a few weeks, and typically it'll then get stored in your cells and organs. The deeper reservoir is your bone. So if you do the blood test for the metals, and the metals are not near the needle in your arm when the blood's drawn to fill that tube for 3 seconds, because each tube that is drawn by the nurses or the staff takes about 3 seconds to fill the tube, sometimes 4, depending on the size of your blood vessel. You're only seeing the metals that are near the needle to show up in the tube, but you're not seeing all your blood, of course, and you're really not seeing anything of what's stored inside your cells because they're in your cells. They're not, available to go into the tube. So it's a peek, it's a screening, it's a quick look, but it's a good test. And invariably when we do that, and we've done it on everybody I think I've seen in 36 plus years, you find some metals floating around. But that's not a reflection of what your total body storage is. So the better test is doing a urine test. So the next step, once we see them in the blood, is to collect a little bit of urine from you while you're there in the office. So you give us a little bit of urine, we send that out. We call it a random urine test. So that random urine looks at 21 metals, a lot more than the 6. So it's a reflection of what's leaking out of storage. So important to understand that that's a better test to show you what you're harboring or holding on to. And then the next step would be to do an IV. We use calcium EDTA, which is a chelating agent. It binds the metals irreversibly, doesn't let them go, and then comes out into the urine. And when the IV is done, it takes about 20 to 30 minutes to do the IV. We give you a container to take home, and you put any urine that's made after that IV is finished into that container for 12 to 24 hours. Then you bring that back to us. So now we're looking at what we pulled out. Little peak for blood test, better look for urine on its own, better, greater test by looking at what comes out after we use the IV to pull it out. So that gives you your best reflection of what you're storing. Now, lots of people have heard do this, do that, detox. What does that mean? Detox with this vitamin, detox with the foot bath, with the foot pads. Tell me what you're detoxing. They can't. at least I can tell you we're looking for heavy metals. We can find them in the blood, find them in the urine, and really find them in the urine after the IV. So we know what's there. And then that IV with the calcium EDTA can be used once a week. Some people skip here or there. But at the end of 10 of those IVs, you repeat that urine after the IV. And now you've got two sources of information, the urine after the first IV, the urine after the 10th IV, and you could actually see what's been, taken out of your body, what's been removed.
Right.
So if you come out with a lot of lead, which a lot of people do, and you see the lead is crossing the page, and now you have half of that lead coming out, you see that you're removing these things from your body. You're depleting them from your body, which is the best proof that they're there for the 3 tests, blood, urine. And now that urine shows that you're depleting it. And that's the beauty of the scientific method, showing that we're able to pull those things out and get them out of your system. Now, everybody's different. Some people have more arsenic because they eat chicken, shrimp, rice, apples, California wine. You could look this all up online. There are 30 vineyards in California, and this was even on the Today Show years ago, that were being investigated for arsenic in the wine because they spray the fields and the plants, the grapes with arsenic to kill infection. They use arsenicals in chicken. This has happened forever in many circumstances, so it kills the germs the chicken gets sick of, but we end up absorbing that. The list goes on and on. Cadmium is linked with breast cancer. Absolute. Aluminum linked with Alzheimer's. So these are facts, and you could look up heavy metals in almost any disease. The other component is that heavy metals will bind to the bad LDL cholesterol to become a foam cell, which now becomes part of the plaque process. So all these things you could easily look at online and understand. But, we tell people, look at this, learn about it. So do you have any chronic issues?
Yeah. Well, some joint pains, a little memory fog. There's things that...
Yeah, brain fog is very common. In some people, it could be just a decline of a couple of nutrients. But we do a big blood test. It's about 20, 25 pages, vitamins, minerals, hormones, heavy metals. So you can correct nutrients, brain fog goes away. You can find allergens, take the allergen out, brain fog goes away. You can see it maybe correlated with heavy metals. Get rid of the metals, brain fog goes away. So it's hard to say at the onset with patients, and certainly talking on the phone with you, but these are the areas where we look at to understand why you may have the brain fog.
Right. Yeah, brain fog, fatigue, little this and that, little joint pain here and there, and
yeah, interesting that, probably 75% of patients that I see are saying the exact same thing. Aches and pains, fatigue, I'm just tired, I can't get out of my own way, and I'm not sleeping as well, et cetera, et cetera. Foggy, I walk into a room, I can't figure out where the keys are, or forget someone's name, or this or that. Do you mind if I ask how old you are?
58.
All right, 58. You're certainly sort of right smack into the progression of hormone decline. So no one at 58 is going to have great hormones. You're also in that zone of, it's not necessarily a happy thing. The happy thing is we can fix it. But also NAD and IGF-I, which are really important for brain function and memory, focus, mood, thought process, word retrieval, hair, skin, nails.
Right.
Those things are important to look at and to correct. So I think although people present with things that drive them crazy and aggravate them, there are answers. This is what the big blood test does. Within 5 days we get the blood work back and we see all of this perfectly in front of us and we start to fix things.
Right. So you do also the IV
intravenous vitamins, correct. Everything from A to Z, intravenous vitamin therapy, intravenous peroxide, the calcium EDTA chelation therapy. We do hormone correction, hormone pellet therapy for men or women who want to have little pellets put under your skin so the hormones are there perfectly for 4 to 6 months. Stem cell therapy, of course, for all the degenerative disorders, Alzheimer's, Parkinson's, MS, stroke, lupus rheumatoid, liver, kidney, heart failure, diabetes, The list goes on and on. Joint degeneration and damage. So, yeah, it's all about fixing your body.
Right. So the IV therapy, the vitamin therapy, does that help Epstein's-Barr? Because that's like
Absolutely.
a big thing of mine. I have.
So that's another cool thing. And I was on the computer the other day looking at research on Epstein-Barr. It's not a very simple bug as most people think. Because, yes, it can cause fatigue and aches and pains and brain fog and such. And remember, it's probably the most common virus in the world because between kindergarten and college, they've estimated that over 90% of the world is exposed at that age. When you're in school with other kids, that one gets it, then everybody gets it. You know, it rifles throughout schools, and if 1,000 kids are in a junior high school or a high school, comes home, gets to brothers, sisters, parents, family, etc. So it's an extremely common bug. It is linked with MS, lupus, 24 cancers, Alzheimer's, Parkinson's, ataxia, meningitis, a lot of bad things, but medical research proves this. This is not just a maybe. I remember looking at a great study that women who had breast cancer, when they took a big cohort of women who had breast cancer, and the pathologists are really great researchers, they were taking the tumor and some extra tissue around the tumor. When they looked at that extra tissue that had no cancer, and they looked for Epstein-Barr in that extra tissue, surrounding tissue, no Epstein-Barr, 99% Epstein-Barr in the cancer cells. So another scary statement. So these are things that we know through great research. So, and then if you look up Epstein-Barr virus on the internet, you can. I tell people go to Google Scholar because it's a great search engine. If you look up, and in the search box you put intravenous vitamin C therapy, you'll see at least 1,300,000 studies. Sometimes it goes up to 1,600,000, 800,000 studies on intravenous vitamin C helping to kill infection, viruses, COVID, Epstein-Barr, shingles, inhibit free radicals, quadruple your killer cells, and a lot of it's been used worldwide against cancer as an adjuvant therapy, as an add-on combination therapy. But that's a discussion for yet another show. So, yeah, a lot of great stuff we could talk about.
Very, very good. Good. All right, so maybe I'll set up an appointment with the office.
Sure. If you'd like to look at some cool videos and all this stuff, the website's drcalapai.com. The Garden City office is 516-794-0404. And we'd love to help you out. I'm there Tuesday, Wednesday, Thursday, Saturday. And we're here
Very
live
good.
Monday
Thank you so much.
and Friday, 12:30, and Saturday at 2:30. Because Frank and Sabrina control all that stuff. That's, they run that. They're the admiral in general, Great. Thank you so much for your call.
Awesome.
Great talking to you.
Thank you. Have a great day.
Yes,
Bye-bye.
thank you. Bye-bye now. Okay, 888-420-9272 if you'd like to call in to ask a question. We'll give people a moment or so if they would like to call in.
So we definitely have our next episode ready. Heavy metals.
Oh, yeah. That's it's scary because, I'm like a trivia person, and I love learning little tidbits of this and that. And then when you start to get into medicine, and, years ago, I graduated medical school in 86. So this is my 39th year of being obsessed with this, stuff. I started looking at heavy metals. Wow, look at this. It can increase the plaque. And all of a sudden you're looking at research in cancer and Alzheimer's and Parkinson's and the list, an organ decline. It's overwhelming. And traditionally, doctors do not want to talk about heavy metals. They don't know about it. There's no reason for them to look at it. And a lot of doctors who specialize, and it's a good thing to specialize. We definitely need specialists, specialty surgeons, all of these things. But heavy metals are pretty much ignored. You don't learn about it in school. You don't learn about it in residency, but they cause major, major issues. And, it's kind of opening up a hornet's nest to talk about heavy metals, aluminum, and mercury in the V word, vaccines. But they're there, and they've always been there. And that's yet another full episode to talk about side effects to those things for all segments of the population. But these are bad things to have in your body. And there's so much evidence and documentation that they damage your body. So metals are 2 and 3 plus charge, ions. And your minerals are 2 and 3 plus charged ions. So if you have receptors on a cell and they need to have minerals get into these areas to work and do the thing, and the metals get there first, now the minerals can't get there. And that's a simplistic way of understanding how they damage and interfere with normal cellular function. It's a whole universe of information, complicated, much more complicated than that. But that's, part of the understanding. It's part of the process. Once again, 888-420-9272. If you'd like to call in to ask a question, you could do so right now. Let's see if we can get another caller or two up on the line. So yeah, heavy metals, it's a big issue, big problem. There's a good book written by a doctor named Richard Lewis. I think he's a PhD. And when I first saw this book, I just was shocked. There are 75 chemicals put into foods routinely, and I think it was 65 in chicken and 75 in steak. And this is a book that goes back for many years, and they keep updating it. But there's a lot of bad stuff that's being put into foods and things we're eating, things we're exposed to. So we got to start thinking about it. Eat organically. Don't use an antiperspirant. Use a deodorant. Try to find something that is as natural as humanly possible. Get the chemicals away. Get rid of pots and pans that are aluminum. You got to be cognizant. If the water coming into your home, you should have tested and maybe put a triple reverse osmosis filter system on the water coming into your house. So bathing, drinking, cooking, all of that is protected against these things, heavy metals and chemicals.
Yeah, I'll say, me and my wife, we moved into an apartment months back and, early before the summer started. And, after a couple months, we're like, what is going on? Our skin was acting different and all these things. And we tested the water. It was the amount of metals in the water and the chlorine amount and all that stuff. Once we got a filter for the shower, it's like half of our skin problems just disappeared.
Big difference. Big difference. And most people don't think about it. You think of your skin, yeah, whatever. It's the largest organ in your body, and your skin interacts with things that are exposed to it. So you have to, in a scientific sort of way, realize that you want to put the best things on your skin, get the best things into your body, get rid of the bad things, and be your own detective. And I've told many thousands of people. I don't know how many people I've seen in 36 plus years. It could be 50,000 more. Because each office, if you add up all the patients I've seen, and I've been telling this, to patients forever. So it's important to kind of take the reins, learn about your body, get some research, listen to podcasts, of course, like this one. Should be your favorite podcast by now. And, make your home environment as perfect as you can. Make your work environment as perfect as you can. Some people work in facilities that are not terribly healthy. I tell them, get an air purifier, start the process. Take steps to make yourself as healthy as you possibly can. Okay, so that's another good show. How many minutes are we out?
We're at 56.
Oh, 56.
Goes quick.
Wow, should we make it a full hour?
Yeah, I mean, we have some dogs to look at. They look pretty beautiful.
Yeah, we got to put the dogs up. So I tell everybody, you got to have happy and fun things in your life. And some people are running back and forth to work, and they're driving themselves crazy, and they just don't get the relaxation component. Some people who do or don't like pets. I've always loved pets. And my little pet kids, my little furry babies, no, not babies, but my little furry kids are awesome. And I wanted to highlight them today on the program. You could look at them on the picture there. So the one in the back, the little one, is a full-grown German Shepherd at 125 pounds.
He might look little.
Zeus. So he looks little compared to baby Delilah, who's just about 10 months now, and she's dwarfs him, or she's, obviously way above his size, and she still thinks she's a little puppy. So a 30-pound baby, she was a little baby, but now she's 150 pounds, and she jumps up on you, and she runs around, and they're just all over the place, which is great. Luckily, I have some property for them to run around on. I take them to the beach. A dog on the beach is like the greatest thing because they smell a million different things. They love running back and forth. It's terrific. It makes them tired. The only slight drawback is that one of the first times I took Delilah to the beach when she was a baby, she saw the water and just bolted and ran right into the water. Of course,
Scary.
I didn't have a blanket or a towel to dry her off, but etc. It's just great to see their energy, and they're just totally connected. They will not leave me alone. If I want to go to the bathroom and I walk into the bathroom, they follow me into the bathroom. If I try to take a shower, so I have to kind of get my own little time where I can just give them something to eat, like a dog bone or something healthy and nutritious, and put it outside my house on the deck so they can go out there and I can have a few minutes to myself. So yeah, but it's wonderful to have such great dogs, great pups. So, and all my friends and family, they ask me every day, "Oh, how are the dogs? How's Delilah? How's Zeus?" It's like, how about asking me about how I'm doing? Nobody cares. So.
And here's my Lola, my mouse pad.
Oh, how beautiful.
Jumping in the snow.
What a beauty. What kind of pup? Is she
She's a boxer.
a boxer?
Yeah.
They're awesome.
She looks like a little cow, though.
What's better than the amazing love of a little dog or cats for people who like cats? They just, of course, the bond there, they lock onto you and they just keep looking at you for encouragement. It's a great thing. So it definitely makes a wonderful part of life. So I think more people should have dogs and go get dogs from shelters so they're not killed. A good friend of mine and his wife and daughter, they have a horse for their daughter. She's 5 years old. Sweet daughter. And to watch her ride this horse like a professional, I'm like, how is that possible? She's a 5-year-old kid. But she rides the horse like she's a pro and does jumping. I'm like,
whoa.
So, yeah, kind of amazing. So I love horses too. So who knows? Maybe someday. All righty. So thank you all for watching the program. Tell your friends to watch and listen and follow and subscribe or whatever you're supposed to do. The website's drcalapai.com. If you'd like to call us at the office, 516-794-0404. Garden City office. We'll be back here again live on Friday. And I think we're live on YouTube, Instagram, and TikTok. Yep. We're working on all that. And then Saturday again at 2:30, we'll come back on live. I got some really cool people to agree to be interviewed. And I can't say the names yet, but my same friend Mike knows a lot of people. So we'll be having some amazing people here on for interviews. As soon as we speak with them and we get them to pick a date that they like, we're going to announce the forthcoming interviews. So really cool people from all walks of life. God bless you all. Thank you for watching, listening.